Let's see about trachoma. Trachoma is also called as Egyptian ophthalmia. Trachoma is nothing but a chronic keratoconjunctivitis. That is, it involves both the cornea and the conjunctiva. Keratoconjunctivitis. This trachoma is one of the leading causes of preventable blindness in the world. The causative organism is Chlamydia trachomatis. This Chlamydia trachomatis has two serotypes, TRIC and LGV. This TRIC has in turn A, B, BA, C and the serowards D to K. In LGV there are L1, L2 and L3. So the serowards Chlamydia trachomatis trick A, B, BA and C causes trachoma, whereas the Chlamydia trachomatis D to K causes inclusion conjunctivitis. And the Chlamydia trachomatis L1, L2, L3 causes a disease called as lymphogranuloma venereum. This is about the causative organism. Next, the predisposing factors. The trachoma is more common in infancy and early childhood. And this is more common in females as compared to males. And the predisposing climate is dry and dusty weather. And this is seen more commonly in low socioeconomic classes because of their poor hygienic conditions, overcrowding, and unsanitary conditions. Then the environmental factors which favor are exposure to dust, smoke, some irritants, and sunlight. These are the predisposing factors for trachoma. Then the modes of spread. The spread can be direct, that is through airborne or waterborne, or it can be vector transmission through flies, or another mode is through material transfer, like sharing of towels, handkerchiefs, etc. Next, coming to the stages, there are two stages. First is phase of active trachoma, and the next stage is phase of cicatricial trachoma. Let's see both of them. First, phase of active trachoma. This occurs during childhood due to active chlamydial infection. So the symptoms seen in the phase of active trachoma are there is foreign body sensation accompanied with lacrimation, stickiness of the eyelids, and there is scanty mucoid discharge. These are the symptoms. Next, the signs. The signs of the phase of active trachoma. In the signs, first let's see the conjunctival signs. The conjunctival signs include there is congestion of the conjunctiva, more commonly in the upper tarsal conjunctiva. Next, there is presence of conjunctival follicles. These are also more common in the upper tarsal conjunctiva. If this is the tarsal conjunctiva, these are the follicles. And there are presence of Leber cells. These Leber cells are large multinucleated cells. These are the Leber cells. And in later stages, there are also signs of necrosis seen. The next conjunctival sign is there is papillary hyperplasia. So in trachoma, we have both follicular and papillary conjunctivitis. These are all the conjunctival signs. Next, coming to the corneal signs of the phase of active trachoma. The corneal signs include, first there can be superficial punctate keratitis and there can be Herbert follicles. These are follicles present in the limbal area. If this is the eye, in the limbal area there are presence of Herbert follicles. These are the Herbert follicles. Next is the important characteristic sign is the progressive pannus. In the stage of active trachoma, there is formation of progressive pannus, which is pathognomic of trachoma. So this progressive pannus is nothing but infiltration of the cornea, which is associated with vascularization. This is seen in the upper part. Here will be the pannus formation. The next phase is phase of cicatricial trachoma. This manifests in the middle age, and this is due to continuous mild chronic inflammation. Which is mediated by type 4 hypersensitivity reaction. Now let's see the signs of cicatricial trachoma. First, conjunctival signs. In the conjunctival signs, there is presence of conjunctival scarring, which is irregular, star-shaped or linear. There is presence of scarring in the sulcus subtarsalis, that is called the Arl's line. A-R-L-T, Arl's line. Scarring of sulcus subtarsalis. The next sign is concretions. Concretions are present in the conjunctiva, which are hard looking whitish deposits. These are due to accumulation of dead epithelial cells with mucus. So there can also be corneal opacity. This is the corneal sign. Corneal opacity can be present in the upper part, and in this stage there is regressive pannus seen. In the phase of active trachoma, we have seen the presence of progressive pannus. In the cicatricial trachoma, there is regressive pannus. Next, there are Herbert's pits. In the phase of active trachoma, we have seen Herbert's follicles. So here, after the healing of their follicles, it forms into Herbert's pits. So these are the corneal signs. Here, we also have lid signs. The lid signs are, there can be trichiasis, which is misdirection of the cilia, or there can be entropion, tylosis, which is nothing but thickening of the eyelashes, lid margin, or there can be ptosis, medarosis, which is loss of the eyelashes. Also, there can be lacrimal apparatus sequelae, which can be chronic dacryocystitis. This is about the two phases of trachoma, the phase of active trachoma and phase of cicatricial trachoma. Next, let's see about the grading of trachoma. There are two gradings. One is Meckellen's classification and the other is Fisto classification given by WHO, World Health Organization. First, let's see the Meckellen's classification. Here, trachoma is classified into four stages: stage 1, 2, 3, and 4. Stage 1 is incipient trachoma. Stage 2 is established trachoma. Stage 3 is cicatrizing trachoma, whereas stage 4 is healed trachoma. This is Meckellen's classification. Next, coming to Fisto classification, Fisto. First is trachomatous inflammation follicular. F stands for follicular. So in this stage, there is at least 5 or more follicles. Present on the upper tarsal conjunctiva. Next stage, I stands for intense inflammatory stage. Here there is inflammation of the upper tarsal conjunctiva. Next, TS. S stands for scarring. Scarring in the tarsal conjunctiva. And also there is presence of Alt's line, as we have seen already. Next is TT. TT stands for trachomatous trichiasis. Trichiasis is nothing but misdirection of the cilia, that is the eyelashes. This is seen and this is said to be trichiasis when at least one eyelash rubs the eyeball. TO stands for trachomatous corneal opacity. So here a visible corneal opacity is present over the pupil. This is Fisto classification given by WHO. Complication of trachoma. The only complication of trachoma is corneal ulcer. There is no other complication of trachoma. Coming to the diagnosis can be made either clinically based on the signs and symptoms, or diagnosis can be made by laboratory investigations. The laboratory investigations include cytology, detection of inclusion bodies by GMSA stain, ELISA, PCR, polymerase chain reaction, or isolation of chlamydia by growing them in McCoy cell lines. Next is differential diagnosis. Differential diagnosis of the phase of active trachoma with follicular hypertrophy and differential diagnosis of phase of active trachoma with papillary hyperplasia. For follicular hypertrophy, the main differential diagnosis is adenoviral follicular conjunctivitis. That is epidemic keratoconjunctivitis. Whereas the differential diagnosis for papillary hyperplasia is spring catara, which is a form of allergic conjunctivitis. Coming to the management, first is treatment of active trachoma. For treating active trachoma, we give antibiotics topically, systemic, and combined topical and systemic. Topical antibiotics given are tetracycline 1% or erythromycin 1% eye ointment. Systemic antibiotic therapies is tetracycline or erythromycin given orally, or we can give doxycycline. Combined is preferred when the inflammation is very severe. So here we give tetracycline 1% ointment along with azithromycin single dose orally. Next is the treatment of cicatricial trachoma. Firstly, we have seen the treatment of active trachoma. Now the cicatricial trachoma. Here, the stage TS, that is trachomatous scarring, we should remove the concretions to be removed, and we should also treat the conjunctival xerosis by teardrops. Next, for stage TI, trachomatous intense inflammatory stage, here for trachomatous trichiasis stage, we perform eyelash removal permanently by using many methods like electrolysis, cryolysis, or radiofrequency epilation, and we can also perform bilamellar tarsal resection, which is the procedure of choice for multiple misdirected eyelashes. Next, for the stage of trachomatis corneal opacity, treatment is penetrating keratectomy and penetrating keratoplasty. This is performed for corneal scarring. This is the treatment. Now the prophylaxis. For prophylaxis, we follow SAFE strategy. SAFE. Here the S stands for surgery, A stands for antibiotics, F for facial cleanliness, and E for environmental hygiene. Surgery is performed for trichiasis and entropion. Antibiotics. The antibiotics given are tetracycline eye ointment along with azithromycin orally single dose. Next, facial hygiene is very important, which is a mode of primary prevention. Here, frequent face washes should be advised and avoid using of common towels, handkerchiefs, etc. Next is environmental hygiene. The environmental hygiene, this is a primordial prevention. Preventing even before the risk factors have occurred. Primary prevention is preventing the disease from occurring when there are risk factors present. Primordial prevention is by providing safe water supply and by controlling the flies which serve as vector for transmission of trachoma, and health education. And here the antibiotics constitute the secondary prevention, that is treating the disease and preventing the complications from occurring. And the surgery is a method of tertiary prevention, which is nothing but rehabilitation. So this is all about trachoma. Thank you.